पूरा ये कर रहा हूँ ताकि आ जाऊँ आप। तो मुझे ये
चलो
लोग मिले
बिल्कुल
भी थे, डेफिनेटली सर मैं आता हूँ
ठीक है
कोशिश कर।
ओके
Good.
जस्ट 2 मिनट
So,
जस्ट वेट।
okay. So, guys, hi, welcome everybody. I think we are all here because of the
हाँ
World Brain Tumor Day. So, I think as all of us who deal with brain tumors on a regular basis, I think this is a good way, even for us to meet up and interact. And Dr. Sandeep, of course, is the one with the biggest news right now, and we will come to that in a little while. But just to kick off the discussion, Dr. Sandeep, can you just tell us a little bit for the all our audience, a little bit about brain tumors and what you commonly see, what is kind of your routine sort of practice, and what the public in general should know or should worry about, in terms of thinking about a brain tumor, because headaches are so common, and I don't think we want any of them to think that headache hone se hi brain tumor ho raha hai. So what are the common things that people should watch out for?
See, firstly and foremost, my simple message to everybody would be that whenever you hear the term brain tumor, don't be scared of it. People think that having a brain tumor is sort of a death warrant. It is not like that. So, most of the patients of brain tumors, whether they are benign or malignant, they can be treated very well and can have a pretty long and fruitful life.
Wonderful.
So typically, brain tumors are of two types, malignant and benign. Benign means non-cancerous tumors. So half the patients that we see are non-cancerous. If they are big tumors, they will need surgery. If they are small tumors, we can treat them by gamma knife. We'll come to that later on. While malignant tumors can be of two types. One is primary malignant tumors of the brain. Most of them will require surgery, followed by radiation and chemotherapy. While there can be secondary tumors, which means that the tumor is elsewhere in the body and has spread to the brain. So many of these tumors, if they are big, they will require surgery. Some of them will require radiotherapy, while many of them can be treated by gamma knife surgery. So, but most of these patients ultimately tend to do well, even in highly malignant tumors, though the lifespan may be short, but surgery results are progressively improving over last few decades, and many patients go back to their working life and lead a fruitful life. So don't be scared of brain tumors.
Wonderful. So, Dr. Jindal, if we can get the discussion, what should the public? What are the symptoms that would make me start thinking about all these things? So, what I need to know as a patient? क्या होने से मुझे लगेगा कि ये सब होने की संभावना है?
Normally, headache is the foremost symptom in most of the patients. But any headache which is not responding to normal analgesic treatment and it is not going, it is bothering, it is not letting the patient sleep properly, and especially when the patient wakes up in the morning, he has an headache which is severe throbbing. Those kinds of patients will need at least further investigation in the form of a basic screening CT scan or an MRI to rule out if something is going wrong. And if this headache is associated with some other symptoms like loss of vision, inability to see, difficulty in hearing, difficulty in walking, difficulty in swallowing things, those patients definitely need a radiological investigation to rule out that something wrong is not there in the brain at least. And
Okay.
also those patients who have progressively increasing headache, then the headache which has been there for a shorter duration and it is progressively increasing with time, they also need an investigation for that.
Wonderful. Dr. Gurmeet, welcome. Good afternoon. So, anything else, and particularly for children, Dr. Saab, because this brain tumors in children, these are things that are a kind of nightmare for, I think, all the parents or all the public. So, particularly in children, what should parents be worried about, in terms of brain tumors?
So absolutely, sir. When we talk about brain tumors, and specifically in children, then the worry context of the parents becomes high. But so how would we come to know whether any of the children are having such symptoms? Is the child will not be able to express as an adult is able to. A child who is somewhat bigger and in the age of 4, 5, or 6 can always say about headaches. Now, a child having headaches, which is frequent headaches, that needs to be really evaluated on the first go. A child who is very small and they have features of what we always say is a raised ICP. That means vomiting features, the features where the early morning the children will have vomiting. Also, there will be balance issues. The children they will not be able to perform as or running activities or walking activities. So it all depends upon what site the tumor is, and mostly these tumors give a feature of pressure in the brain, or raised pressure, or hydrocephalus, as we say. Also, the children can present with seizures. Patient can have fits, which if any of the child has, then it needs to be evaluated with an MRI to find out what actually it is. So this is what a child, but nothing to worry. If evaluation is done, then there is treatment, and as Dr. Sandeep Vaishya told, that we don't have to fear about brain tumors. They are treatable. Yes.
Wonderful. Thank you, Dr. Gurmeet. And from our lovely garden city of Bengaluru, Dr. Raghuram.
Yes, sir.
Uh, Apart from headaches, either for children or for adults, what are the symptoms would worry us about, sort of, worry the public in terms of thinking that something more serious than maybe just the odd headache is going on?
Correct.
Anything else that?
Yeah. So exactly, because we don't have to really get worried if you just get a routine headache. Someday you might have had a long
Hmm.
day or a difficult day, or you must have gone out somewhere. So all the headaches, you don't have to really get worried that you have a brain tumor and rush to a doctor. So what are the
Yeah.
most important danger signs? Like already a few of our experts have discussed. If the headache becomes very severe, it's not going down. You start vomiting. You can't tolerate anything that you eat. Everything you eat, you start vomiting. Then, in addition to the headache, you find that you are having giddiness, or you are having imbalance, or you are having speech disturbance or weakness. All of these are red flags which you should not ignore. It doesn't still mean that you have a tumor, but all these red flags, you should immediately go to your family physician or to a nearby neurologist or a neurosurgeon and show it to them so that they can evaluate you and examine you in detail and reassure you if it is a regular headache, and if they are also suspicious that it is something to do with the brain, they would probably suggest you to undergo any kind of an investigation, maybe a CT or an MRI.
Right. Wonderful. So, hi, Dr. Rahul. Welcome. Glad you
Good
could
evening.
manage to get out
Sorry
of
for
your
being late.
surgery.
Yeah.
Good afternoon. So, Dr. Rahul, now
Yeah.
all the lay people, we are worried about radiation and scans, and whether they are actually harmful for people. Now, a lot of people kind of put off getting any tests done, even when there is concern with the symptoms, because they think that the scans themselves can be harmful. So, what would be your views on, number one, what is the routine investigations, and whether at all they are harmful for the public?
So when we are talking about these symptoms, which are headache, vomitings, giddiness, or even a seizure, so the best investigation to evaluate these symptoms is the MRI of the brain. So MRI of the brain is being routinely done for last 2-3 decades. Initially, it was available at very few centers and it was considered to be expensive. I think over last 2 decades, the price of doing an MRI has not changed. Instead, the cost of everything has increased. So an MRI is so readily available, especially in India, that it can be done at the drop of the hat. So what I feel is that MRI of the brain is the most important investigation to prove or to rule out any tumor in the brain. To an
Right.
extent of 99% accuracy, it can even rule out a brain tumor, just a plain MRI of the brain. Now, if there is a tumor or if there is a very small tumor which we are suspicious about, we should go for a contrast MRI of the brain. And if contrast MRI of the brain is normal, then at least we are almost near 99 to 100% sure that there is no tumor in the brain. MRI can be
Right.
done several times in a month, week, or year without any harm, any proven harm till now. The only problems comes which has been proven, which has been found out just 4 or 5 years ago, that in a patient of chronic renal failure or an acute renal failure, the dye which is given for a contrast MRI should not be given preferably because it may have a long-term consequence. Now, I have seen so many doctors prescribing a CT scan for a chronic headache. I must tell you,
Yes.
CT scan has a little bit of radiation hazard. Nowadays, a new quality CT scan is not that harmful, but CT scan can miss out tumors. A plain CT scan for a chronic head, for a headache or vomiting or a seizure is not a very good investigation unless there is a background of sudden severe headache due to brain hemorrhage or we are suspecting any raised pressure because of ventriculomegaly or increased water in the brain or there is a history of trauma. Because if you have to look for blood, then CT scan is better. Otherwise, MRI is the most important investigation for this. Apart from MRI, MRI also has various sequences which help us determine the quality of the tumor, presence of the tumor, differentiate from certain non-tumorous lesions like tuberculosis, like infective lesions. So MRI is the best investigation and a good quality MRI will help us the most. Others are CT scan. X-rays recently have been found to be of very little value in detecting any brain tumor. Other investigations can be blood investigations. One important investigation profile of investigation is the hormonal profile. So, if some patients have symptoms which are suggesting any hormonal disturbance, then we have to go for hormone testing along with the MRI or CT scan or other investigations, which includes basically the hormones which are related to the pituitary tumor in our body. So these are the main
Right.
investigations which are important. Sometimes in whom we have a pre-existing cancer in the body, we suspect that any tumor has migrated from some other part of the body, then PET CT scan or PET MRI scan is again a very useful investigation.
Right. Thank you, Dr. Rahul. Dr. Sandeep, now that we have sort of, say, got a scan which shows a brain tumor, and the average patient, like you said, initially immediately starts thinking that that is it, ऊपर से बुलावा आ गया. So, and you have pointed out that tumors can be benign, as in non-cancerous and cancerous. So can you make out from the CT or the MRI whether a tumor is likely to be benign or malignant? I mean, can we reassure patients even before the biopsy that they may be looking at a favorable as opposed to a non-favorable pathology?
See, 90-95% times you can make out whether it is a benign tumor or a malignant tumor. जो कैंसरस ट्यूमर होता है वो ब्रेन के अंदर होता है, जो नॉन कैंसरस ट्यूमर होता है वो ब्रेन के बाहर होता है और ब्रेन को प्रेस कर रहा होता है. कुछ सिचुएशंस ऐसी हो सकती हैं कि बहुत क्लियर नहीं है कि कैंसर से या नॉन कैंसर से, वो सर्जरी के बाद बायोप्सी की रिपोर्ट में पता चलता है.
Right. So, Dr. Raghuram, is the treatment of all brain tumors surgical, or do any of them get treated without surgery also?
Yes, definitely. It's not that if you have been diagnosed to have a brain tumor that you should immediately go for a surgery. There are definitely certain tumors which we call as low-grade tumors and certain tumors which are not very big, where we would suggest that we would regularly monitor these patients. Probably do a repeat imaging every 3 months and watch their symptoms also. And if they're asymptomatic and these tumors don't grow, they may not need surgery. In case they become symptomatic and they
Sorry, you're breaking
start
up, Dr.
producing
Akura.
symptoms, then only they will need surgery.
Right.
Yeah,
Okay.
only if they have symptoms and if they have these symptoms, we can serially monitor them with regular MRI scans and watch them closely, and we may not have to operate if they don't become symptomatic.
Right. Wonderful. So, Dr. Gurmeet, if the patients do need surgery, how dangerous are operations on the brain? As a layperson, I would be terrified if I was told that I needed an operation on my brain. But what would you normally sort of counsel your patients? Are they very worrying?
Hmm. So very apt question. Every patient who is diagnosed with a brain tumor, the first thing is how safe is the surgery? Now, so I tell this to all my patients, and I tell this in this forum also, that the brain tumor surgery or the neurosurgery itself has evolved to a great extent from what it was before. We have got a big armamentarium with us. बहुत सारी चीज़ें जो हमारे साथ हैं जिसमें हम localization to find out कि brain के अंदर where all the tracts are involved, which is the safe area, which can be removed. Uh, so all this, and during the operation we can monitor the patient's outcome. We can monitor the power. So uh, so brain tumor surgery overall is a safe surgery if depends upon the locations. There are some locations which is that the brain stem or the small brain for local people. So in that area the tumor is, then the chances or the risks increase. But it all depends upon that place also. It depends upon where exactly it is. So overall, nothing to worry about a surgical procedure on the brain or a brain tumor, as there can be non-cancerous tumor which are outside the brain and pushing the brain, which are almost completely safe and completely removed. Inside the brain also, the tumors which can be removed safely with a good, we call it as gross total excision. So it is a safe surgery on. Yes.
Wonderful. Dr. Anupam, can you,
Yes.
Dr. Gurmeet just sort of talked about a whole armamentarium of stuff that we have, which makes brain surgery safer. So, what are the kind of things that you routinely use in your practice, that makes surgery so much more safer and technologically advanced?
As Dr. Puneet has already told, first we need to localize the tumor exactly, define its
Yes, sir.
size, extent, location. Once we have defined the tumor properties, then we first see whether it is on the surface or it is in the deep. Suppose the tumor is on the surface, then you can give an option of doing an awake craniotomy, or in which the patient can be operated while he is awake. That is probably the safest type of neurosurgical uh, surgery which can be offered for a brain tumor, because while operating you can stimulate the brain and see what effects or side effects the stimulation is producing, and depending upon that you can define your resection or removal of the tumor to be complete or incomplete without producing any side effects for the patient. Once we have defined that, uh, if the patient is not cooperative or if he is not willing for an awake craniotomy despite a tumor being superficial, then you can use neuronavigation, which is another tool which during surgery through which you can localize the tumor exactly. You can make a smaller opening than your conventional brain tumor surgery, and then you remove exactly the amount that is required or which is told by your navigation system. Also, you can use certain dyes during surgery and define your tumor extent, and you can avoid removing the normal brain tissue during tumor surgery. Especially in invasive tumors, you can localize the tumor with these dyes during surgery using special filters in the microscope or special lights. And once you have defined that tumor extent, then you remove only that part of the brain which is harboring the tumor, and leave you can leave the normal tissue behind. That means that your surgery will produce minimum or less side effects, or will be less deleterious to the patient once you have operated. For patients who
Wonderful.
have tumors which are skull based tumors like pituitary tumors, clival tumors, or parasagittal tumors which are in the skull base, they can be operated through an endoscope or through nose. So that also makes surgery, like pituitary tumors were 20 years or 30 years earlier, they were operated by craniotomy. Now, most of these tumors are now operated by endoscope, which makes the resection much safer. Your the patient brain is not touched, so you don't need many anti-epileptics later on. The side effects like hormonal profile, electrolyte imbalance are much better preserved with this kind of surgery than an open brain tumor surgery which was offered earlier. So the techniques have changed. Plus, as Dr. Gurneet has said, now you can pre-operatively fuse your DTI imaging or tract imaging with your brain tumor, normal brain tumor MRI, which can tell which tract is passing and from the front, from the back, or through the tumor. And you can tell pre-operatively to the patient that we will probably not be able to save this part of the tract. So you are likely to have weakness of one hand or weakness of leg or loss of sensation in one part of the body or the other, or you can have some visual memory impairment or some verbal memory impairment or speech difficulties depending upon the tract morphology located around the tumor.
Wonderful. So, Dr. Rahul, how long does an average, what is the average length of stay in the hospital for a patient with, say, an elective brain tumor? Yeah?
So the elective in elective surgery for brain tumor, it depends on the size and location of the tumor, which may help in guiding how long the patient has to stay in the hospital. Usually, when we see the surface extraaxial tumors like meningioma tumor or any surface glioma, which are not in the important part of the brain, where we operate, we usually admit the patient on the same day. We operate upon the patient, keep the patient in the ICU for at least 1 day, and then by third or fourth day morning we can discharge the patient if the patient doesn't have any major issues. And these patients, they do well, and 99% of these patients can be discharged in that way. Some patients who have a skull based tumor, or in which some important area of the brain is involved, or maybe there is some excessive bleeding during the surgery and the ICU stay increases by 1 or 2 days, there the total length of stay usually is 5 to 6 days. Very, very rarely, if there is a problem with the patient due to the tumor, there is some residual tumor, we may have to go again, or there is some other complication, then the patient stay in the ICU especially increases. But once the patient is out of the ICU, then the stay in the hospital is usually 2 to 3 days. So average length of stay for a normal brain tumor surgery in 99%, 95% of the cases is 4 to 5 days.
Wonderful. That is very reassuring. So, Dr. Raghuram, what can I do to prevent, a brain tumor from happening? Is there anything I can do? I think we lost Dr. Raghuram. So, Dr. Gurmeet, anything we can do to prevent brain tumors from happening?
Okay, so so mostly for brain tumors, we when people come and ask that why did this happen to us, the
Absolutely.
answer, yeah, the answer for that is we don't know. The main There are some tumors which are genetically, we know the cause of the tumors, which are mainly the tumors of in children, but otherwise grossly we don't know why one particular person is having a tumor. Over the time we don't have anything that we can tell that if you don't do this then you will not get a brain tumor. So what has to be done is to be vigilant about, if you have any red flags which was explained in the symptoms, like a headache, a persistent headache which is at least twice in a week, then a person is having headache. Or if your headache is associated with vomiting, or if you have any weakness developing on one side, or numbness, or if you have seizures, or if you have balance problem, early diagnosis is the key. Prevention at present. So there are some thoughts about radiation from the phone, but that is a query.
So far,
It's,
yes.
yes, that's always a query. It probably is not related. So we don't have anything. Only thing is vigilance is what is required for us to
Right.
understand.
So I often tell my patients that I think having a bad tumor is just like drawing a bad card in a lottery. I mean, it is just something that
Sure.
happens and on which you have no control. So
Absolutely,
yeah,
absolutely.
yeah, wonderful. So,
Yeah.
Dr. Vaishya, I think we have, spoken a lot about the surgery and by and large about how safe the surgery is. But obviously, despite however safe an operation is, I think most patients would rather not have a hole in their head if they could help it. So, what other treatment options are there, sir?
So, some patients, as he mentioned, who have a very small tumor, they can be observed whether the tumor
Right.
grows or not. But by and large, for example, if we take benign tumors like meningioma, statistically speaking, any meningioma above 2 centimeters in size, there is 60 to 70% chance that it will grow in lifetime. So, uh, rather than waiting for the symptoms to appear and the tumor growing, but if the tumor grows and the symptoms appear, then surgery is the only option. But to kill the tumor in the bud, the best option is to do stereotactic radiosurgery. And there are various equipments available to perform stereotactic radiosurgery. And gamma knife is one of the most time tested and the safest and most accurate equipment. And at Fortis Gurgaon, we just launched the latest gamma knife, and this is the first installation in the country of its kind. So,
Oh,
where is gamma knife indicated? So, any benign tumor which is smaller than 3 centimeters, or any tumor he has undergone surgery and some of it is remaining after surgery, they are perfectly suited for gamma knife. Primary malignant tumors of the brain generally are not good for gamma knife, and there will be very, very selected cases where you would. But on the other hand, metastatic tumors, particularly multiple metastases in the brain, gamma knife is the best thing for them, because if you give whole brain radiation, that will damage the brain ultimately in few months. Or in LINAC-based procedures like other stereotactic radiosurgery systems, if you treat more than 3 or 4 metastases, again, that will be almost treating whole brain by radiation. So gamma knife
right.
is so precise that it can treat 30, 40 metastases also at the same time. So for multiple metastases, that is a perfect thing.
Right.
And
But is it very expensive, Dr. Sandeep, to have a
yeah,
gamma knife treatment done?
as it is almost actually it is cheaper than many surgeries, or sometimes almost at the same cost as a surgical procedure. It costs somewhere between 4 to 5 lakh rupees, depending on what we are treating.
Right.
But again,
So,
like any treatment, gamma knife is also a double-edged sword. If you don't select the patient properly, I have seen many patients who have big tumors and who
hmm,
definitely need surgery, but they have been treated by gamma knife surgery. So radiation is also a source. If you treat an unindicated patient or a patient who is not suitable for that, again, radiation can also produce damage. So you have to be very selective in the patients where you can do it.
right. So, Dr. Raghuram, good to have you back. And what would you like to tell patients about the quality of life once you've kind of been diagnosed with a brain tumor? Because a lot of patients worry about, whether they will have any huge disability and how they would be able to carry on with their activities of daily living. So, what would you like to say to them? I think we've lost Dr. Raghuram again. So, Dr. Rahul, sir,
Yeah.
would you,
Yeah.
quality of life in patients with brain tumors?
So as it has been discussed that the quality
You were
of
running
life
from the
depends
beginning.
on
Yeah.
in what stage the patient has come to us. So some patients who are coming very late, they have already developed some deficits. Like some patients with tumors near our optic apparatus, they may be blind. The vision has already gone. Some patients have tumors which are in the important part of the brain or maybe adjacent to it, which has grown in size, and we have weakness of one side of the body. Some patients they come with complete hearing loss. So some patients they have delayed their treatment and now they are multiple tumors maybe. There is metastasis. So if the patient is coming to us with all these deficits, then definitely the quality of life may or may not improve after surgery. But when the patient comes with normal, everything in normal, but some minor symptoms and no significant signs in their body, then it depends on the size of the tumor, location of the tumor, and how well the tumor will behave in the post-operative period. So if we talk about benign tumors, this is very true that if we are able to remove the tumor almost completely and safely without giving any deficits, the patient will remain so for his whole life. But definitely regular follow-up is required so that we can check for the recurrence of the tumor in case that happens, and again we can treat it early. As for benign tumors, we discussed that radiation therapy, especially gamma knife, is very helpful. When we come to the malignant tumors, they can be of various types. They can be grade 3 or grade 4 type of malignant brain tumors. There definitely the quality of life may be compromised and the longevity may not be so good. So again, how far, how much the tumor we can remove, that is important. Secondly, how fast we give the radiation therapy and the chemotherapy, and how effective the radiation therapy and chemotherapy are in that patient is again determines the quality and longevity of life, and also the biological behavior of the tumor. In some tumors, malignant tumors, they may behave very aggressive and they may recur within 1 year of the excision and all the adjuvant therapy, and sometimes they may not recur for more than 5-7 years. So all malignant tumors ultimately will recur in the brain. That is for true. That will always happen. But we can delay it by appropriate therapy and faster therapy and regular follow-up. And if required, we can reoperate and re-radiate the patients again.
Right. Dr. Anupam, lastly, patients also kind of want to know that how can we help them if they do end up having, some kind of a disability or a weakness. So often they are not very clear about what are the facilities or services available to kind of help them. So can you just, tell us a little bit about, so even if the patient has a disability, what are the kind of things that we can offer them that will help them, A, recover from their disability, and B, try and lead as normal a life as possible? Sorry, you're muted, Dr. Anupam.
Yeah, sorry.
Right.
The disability in most of the patients of brain tumors who have malignant tumors are usually persistent, and they, even if they go, they most of the time it may not go completely. So they need a caretaker, definitely, if possible from the family, and if not possible from the family, then there are several home care services type of things are available, which can help them in leading a near normal or a fruitful life. The other thing is that regular physiotherapy is required in most patients who develop one side of weakness of the body and who are unable to walk, unable to take care of their continence part, and those patients who had developed speech deficit or speech disability after surgery or because of the tumor per se, they also need some good speech therapists, which are available, I think, almost everywhere in India now. And even in the small towns, speech therapists and good physiotherapists are available, which can give you a good quality of life.
Wonderful. So I think we've kind of covered a lot of ground today with regard to how brain tumors present, the fact that they can be benign or malignant, that there is a lot of good imaging technology which is safe and not very expensive to help come to a diagnosis. And that a lot of these tumors, the primary management is usually surgical, other than the small ones where one can wait and watch, and in, say, very elderly or infirm patients. And, when you do need surgery, then there is a lot of technology available that makes this kind of surgery safe. So there is navigation, there is awake brain surgery, there is neuromonitoring during surgery. Apart from the advances that have happened in the field of anesthesia and intensive care, which also makes the outcome for all these patients so much better and safer. Then we also discussed about the fact that unfortunately there's nothing much that you can do to prevent brain tumors from happening. And if you do have any disability either from before the surgery or after the surgery, then there is a lot of help available in terms of physical therapy, speech therapy, occupational therapy, all kinds of therapy. And largely in benign tumors, a lot of these disabilities can slowly, get better or get even. Whereas, even if they don't, then there are home care services that are available to help patients. And lastly, again, given the fact that I think we are launching a super duper brand new gamma knife in the Fortis Memorial Research Center. So I think, Dr. Sandeep touched upon the other treatment that is commonly performed for a number of conditions in which chiefly brain tumors, both benign and malignant, figure. But the gamma knife is also a very versatile instrument that can be used for other conditions, right? So, Dr. Sandeep, if you can briefly touch on, just the non sort of brain tumor uses of the gamma knife, and then we will kind of wrap up the session with that. Yeah.
So amongst the non-tumorous condition, the commonest thing that we treat is arteriovenous malformations. It is fantastic for AVMs because a lot of AVMs are deep-seated in difficult locations to operate or embolize. Even after embolization, most of them don't go completely. So gamma knife is absolutely boon for them. Post gamma knife, you do MRI after 2 years, 3 years, you don't see a trace of the lesion there. So it is fantastic for AVMs. Then the other conditions that are treated are trigeminal neuralgia. Though my first choice is always surgery in those patients, but many patients cannot undergo surgery or some have failed surgery. So in those patients, gamma knife is a very versatile tool. Then there are other functional disorders which is occasionally used like obsessive compulsive disorders, sometimes tremors, epilepsy. So some of these things also can be treated.
Wonderful. So I would like to thank all of you for being here today and for participating in this discussion on brain tumors. Would anybody like to add anything else before we wrap up the session? Dr. Anupam, Dr. Gurmeet, Dr. Rao? Yes?
So
Yes,
I would
Dr.
like
Rao.
to talk about the point of good anesthesia. So recently, in last 1 or 2 decades, a lot of neuroanesthetists have come up. A lot of new
Yes.
technology, new machines have come up. I think the anesthesia for brain surgery has become very safe. I remember my days about 20 years ago during my residency. A lot of patients had brain bulge during the surgery, but now we hardly see those brain bulge. Secondly,
That's
the
right.
post-operative ICU care done by the renal anesthetist again is very imperative. They can pick up early signs of complication, deterioration like seizures, like unconsciousness, and any other deficits. So, a center which is equipped with a neuro anesthesia team as well as the post-operative ICU, at least for first 24 hours, is managed by a neuro anesthetist. Then the outcome of brain tumor surgery again improves significantly.
Wonderful. So I think, we will close by saying that, while it is best to be healthy and to have no illnesses, but I think it is not all doom and gloom if you do get diagnosed with a brain tumor. It is something that we all see and deal with very commonly. And by and large, these have a very good outcome as long as they are picked up and treated appropriately in centers that are well equipped and well experienced to deal with them. So I thank all of you for being here for this discussion today. And let us hope that we can all help all the patients who ever have to suffer with a brain tumor and provide them with the best possible care for their condition. Thank you.
Thank you.
Okay.
Thank you.
Thank you.
Thank you, everyone. Thank you.